Hey guys, welcome to my channel. So today's video is going to be a health update. It's been 5, almost 6 months since I posted a health update. So I figured a lot has happened since then and I wanted to update you on that. So the last health update was I had kind of finished all the GI testing and the doctor went, okay, you know what? We're going to do a colonoscopy and we're going to figure this out. So, yeah, that was kind of where I left off. So, rewind back to May. May 5th, I had my GI appointment. And he didn't really say anything. It was more or less, I had the appointment anyway, and I was still having all the GI symptoms, so he said, okay, you know what, we'll put you on Imodium for the diarrhea, and we'll try that. And then I'll see you on May 20th for your colonoscopy. And the colonoscopy didn't really show anything. It showed some inflammation, and to be honest, every doctor said the same thing. Inflammation on colonoscopy is pretty much normal because of the prep. You cannot use the bathroom almost constantly for 12 plus hours and not have some type of inflammation. But I did good for a few weeks past the colonoscopy. I didn't really have any major problems. I wasn't as tired from the anesthesia. I wasn't as out of it. I did still take a few days off and take it extremely easy to help me with that, but it didn't kick my butt like my endoscopy did. But I think part of that reason was I had my endoscopy 5 days before Christmas, so I didn't really get a chance to rest. Or take it easy. And with the colonoscopy, there wasn't anything going on, so I had a chance to rest. I had a chance to take it easy. But after having a few days to recover from it, I was back to my normal. And then probably about a week or so later, I started experiencing severe fatigue, weakness. My legs started going numb again and giving out on me. And I started having blackouts again. And I hadn't been passing out for a while, but I also have POTS, and I know that passing out is just part of that for me. And no, not everybody with POTS passes out, but I do, so yeah. But finally, June 5th, I got to the doctor. I got lucky because my appointment was June 20th, and I put in for if an earlier appointment opens up. And I got extremely lucky that an appointment had opened up. But the doctor basically said, okay, so we're gonna trial off the propanolol for a week and see what that does and see if that helps. We also did some blood work, and the blood work showed a low iron level. Like, it wasn't low, it was on the lower end of normal, but it was low enough for him to say, okay, We're going to repeat blood work in a couple of weeks. But my ferritin was still elevated, and typically that's not how it works. Typically, if your iron's low, your ferritin is low. And in my case, I have an elevated ferritin and a low iron level. So I did blood work 2 weeks later just to see where we were at, and my iron was still dropping. So at this point, my iron was officially low. And we had to figure out what can we do to bring the iron level up without increasing the ferritin extremely dramatically. So we did some iron supplements. That was basically what we started with, just iron supplements. And then I went back for 2 weeks later and did repeat lab work again to figure out where the iron level. It was still low, but it had gone back up to the lower end of normal. So right now we are still kind of working on just figuring out where I need to be with my iron level and what I need to be taking to fix it. Because the doctor doesn't want to do infusions with me because I have family history on both sides of having issues with iron infusions. So the doctor's like, I don't even want to try you on that, because if it's a genetic thing, we don't want to risk it. But on the 17th of June, I went to the cardiologist. I was still having issues. We still couldn't figure out what it was. At this point, we were kind of questioning, is this a flare? Because that happens, or what's going on? But the cardiologist, I was on 20 milligrams of propranolol. So the cardiologist said, okay, we'll knock you down to 10 milligrams of propranolol and we'll do it twice a day. And then he started me on midodrine 2 times a day to see if it would help increase my heart rate and my blood pressure. And then after that, if we knew it would help, we could take me off of the mestinon eventually. But he'd also mentioned pharmacogenetic testing to see how my body was actually responding to the medications I was on. And he said if none of that worked, we would look into Keppra, because he figured I was having seizures or something instead of like actual pass out blackouts. But the cardiologist in June, for like the last 2 times I'd seen him, had been obsessed with me having a neurological issue and not it being cardiac, because he just didn't want to deal with it. And that's what my cardiologist is. Sometimes he's really helpful and he is great, and other times he's just kind of, okay, this is what you're doing and it's not helping, so this is what I want you to do so I can get rid of you. But he told me to follow up in September and message him in a couple of weeks to tell him how I was doing on the new meds. So in July, like the 2nd of July, I ended up increasing my midodrine to 5 milligrams a day instead of 2.5, and I was still doing it twice a day because my blood pressure, the first week I was on the midodrine, it had worked. It had worked great. blood pressure was up, pulse was kind of staying where it was normal at, but within 2 or 3 hours of taking the Minigerin, my blood pressure was tanking and dropping again, and was still being super low at night. So that's when we decided, okay, let's increase this Minigerin to see if this helps. I did good. After we increased it, my body was like, okay, let's do this. This is what's going to help. Then the 19th of July, I ended up so freaking sick that I couldn't get out of bed. And nothing was helping me. I felt like complete shit. And it had been a while since I had had a day where I was stuck in bed and I couldn't do anything. And I was so sick, I actually called my friend, who I call when I ask for stuff, because his wife has POTS. And I asked, and I said, so at what point does your wife go to the hospital? And he laughed and said, well, given she works at the hospital every day. And I said, okay, I'm not being funny. Like, for a POTS flare, at what point does she go? And he's a paramedic, so I've known him for years, and this is a weird friendship that we have. But it just so happens that me and his wife have the same issue, and this is what we do. We go back and forth on stuff. I didn't end up going to the hospital, even though I got close to. I just kind of kept going, okay, I'm going to chug my water. I'm going to chug my Gatorade. And I'm going to rest, and I'm going to sleep it off, and I'm going to deal with it that way. And I kind of came out of it, like, I figured I was in a flare the entire time, but the 19th was the day that it hit me and went, you have to stop. So I think the 19th of July was just my body's way of saying, set down, slow down, stop doing stuff even though you know you don't feel good. So the next day I woke up and I felt a little bit better. I just kind of kept taking it easy. And that's just what I did. I don't remember when I actually, like, me full on coming out of the flare probably didn't actually end until August. I don't have it in my notes because, yeah. But I was in a flare for basically 2 months, and the day in July that I couldn't get out of bed was basically my body saying, hey, you're in a flare, and you have been, and you know it, so just rest. But July 22nd, I had a sleep medicine consult. I've been talking to my doctor for months about fatigue and about just not, like, what do I do? And my sleeping pills weren't working. I was on 200 of trazodone, and it just was not helping. But the doctor said, okay, you need to go and have a sleep study. But that's not how it works. Your doctor can't actually schedule you for a sleep study. You have to go in for a sleep medicine consult, and then that doctor decides, okay, so you need this kind of sleep study, and this is when we're going to do it. So I had that consult with him, with the sleep medicine specialist, and basically he said, I can't do anything. There's nothing I can do for you, and I can't lower your trazodone without your PCP knowing, or without your PCP having a say in it. So yeah. So that's what I did. And then I was on vacation for like 6 days after that. So I just didn't bother. Then when I came back from vacation, July 30th was the day that I had the pharmacogenetic testing consult. And that was just to talk about if it would help. And I was basically told this may not help you. This most likely will not help you because of what the doctor wants to test for. This might not tell you anything. But I decided, you know what? I'm going to go with it. I'm going to go through with it anyway just to see if this can help me. And if it can't help me now, maybe it'll help me in the future. But August 1st, I went in for repeat blood work on my iron levels, and while I was there, I kind of mentioned to the doctor, because I didn't have an appointment with him, but when I went in for my blood work, he was free for a few minutes, and I said, can I talk to him? And they said, yeah, let me go get him. So I went and talked to him for a few minutes and said, can I lower my dose of my trazodone and we'll see if it helps. And kind of gave him what had happened on the sleep medicine consult. And so I lowered my trazodone dose, and within a few days, I noticed that it was making a dramatic improvement. I wasn't fatigued like I had been. And we were kind of hoping that me being on 200 milligrams of trazodone was just too much for my body. And that was the problem. And so far, it seems to be that's what the problem was. Because, knock on wood, I'm still not having issues with fatigue. I'm like fatigued here and there, but not like I was when I was on 200 milligrams of trazodone. But at this point, I also am chasing after an 18-month-old. And and with it being fall, my body's going to get more fatigued anyway. So, yeah. But then, August 9th, I wake up in the middle of the night, throwing up, diarrhea, don't know what the heck's going on with me, because I don't do this. Even with my GI issues and everything, I do not do that. Lo and behold, I ended up with the stomach flu. And I've been doing pretty good on all my stomach issues and all my GI issues, and been kind of settled, and I hadn't been having problems. And then everything that had been feeling better got worse. So I was kind of back to my normal. So, and it just kind of worked out that I had a GI appointment on August 18th. So I went in, and he said, okay, since you just got over the stomach flu, then go back on a probiotic, build up your good bacteria, see if that'll help. And he started me on Xifaxan for SIBO, or small intestinal bacterial overgrowth, because he said that's really the only thing that's fitting me anymore. IBS doesn't really fit. I don't have celiac, I don't have Crohn's, I don't have anything that we've tested for. And while we tested for SIBO, he said only like, that test is only like 85% accurate, and when you have POTS, it makes it less accurate, which is nice. And you're also at a higher risk for SIBO when you have POTS. So we did the Xifaxan for the SIBO, and my last day on that was the 28th of August, and it had seemed to help. It actually, and it still kind of does seem to help. So I guess maybe, knock on wood, I had SIBO and we knocked it out. I hope we did, because my insurance will no longer cover that Xifaxan because it was over $2,000. So yeah. But at this point, I'm with the GI issues. Even though I am better, I'm at this point of we are pinpointing sensitivities. I've got to go through everything I eat every day and go, okay, so this bothers me and that bothers me. And so far, even though it's October, I have not really found anything consistent that bothers me. One day I can eat an onion and it bothers me. The next day, or a week or so later, I can eat an onion and have no problem. So it's like, what? We don't know. So we don't know if it's food sensitivities or if it's just POTS or what doing everything with my GI system. And as I've learned, sometimes you may never know. But September 3rd, I got my pharmacogenetic testing results. And basically, it said the reason I'd been on metoprolol before, which is another beta blocker, before my propranolol. And basically we learned that I am a slow metabolizer of metoprolol, so it's not going to work for me the way it needs to, and it's going to kick my butt when I take it, which is exactly what it did. We also found that I needed to go off the Protonics, and that there was a whole bunch of stuff. But basically, we learned that I can't take statins. If I ever need to take a statin, I can't take one because it's not going to do anything for me. And there was something else. There was a whole list of things that this test that may not have even helped me actually did help me determine, okay, so this is what you can take and this is what you can't take. And even if you don't need it right now, in the future, we have it there saying, hey, she can't take this, isn't going to help her. But the woman who did the testing and did the results said, okay, so you need to talk to your doctor about going off the Protonics and trying something different, because the Protonics just isn't helping you. And I'd kind of known that it hadn't been helping, but at the same time, it's me. I have so many issues that we weren't even exactly sure that that's what that was. It wasn't helping me. But by the 14th of September, my belching and my indigestion and all that were so much worse. It wasn't funny. It would last for days. It was weird. It was coming in waves. One day I would be fine, and then I would have a really bad symptom day, and I would have gas and pressure so much right here that it would go down my arm and feel like I was having a heart attack, and that would last for days. So just based off that and the fact that my primary care was in charge of my Protonics, I made an appointment with him to figure out what else we can do. But in between that appointment, because I wasn't able to get an appointment with my GI or my primary care until October 6th. So I had a while in between. But the 16th of September, I followed up with my cardiologist, and we had talked. The Midodrine's actually helping. I'm feeling better. And my mom goes, she's got a little bit of pep in her step, and I went, pep? Yeah. And my mom goes, fine. It's not really pep, because I don't have pep. I swear I'm allergic to pep. But I was moving faster. I was doing stuff a little bit better than I had been. So we kind of figured out that the flare had gone away, and then the Midodrine was helping. But at this point, the cardiologist is like, okay, we're going to titrate off the Mestinon, because we counted it out, and I was taking medicine for my heart 8 times a day. And I still am, as I'm titrating off the Mestinon. But basically, I'm lowering my dose every few weeks, and hopefully by March, when I go back to the cardiologist, I will be completely off of the Mestinon. And I'm doing this alone, but at the same time, I do have him where I can call him and I can message him. So if I need help, or if I need to go back on the meds, or I have an issue, then all I have to do is message him. So yeah. But within a few days of seeing the cardiologist, because I did really good a few days around the time of my cardiologist appointment. And within a few days, I was back to, this isn't helping. I've got to find something that helps. And the belching and the indigestion were just so much worse. And I know with me, sometimes I have really good days, sometimes I have really bad days. It doesn't matter what symptom it is. That's just how it works with me. But by the end of September, it was so bad that I couldn't eat without my stomach being in so much pain, that I just wanted, I was at one point of, okay, we've got to do something short of me removing my internal organs, because it was hurting that bad. I couldn't sleep. No meds were helping anything. A heating pad wasn't helping. I was curled up in pain, and I was sitting there going, okay, so how do we do this? What do I do for this? And no doctor I talked to could say anything. And then all the symptoms were getting worse at night, and yeah. So I don't know. Like a day or two before I went to the doctor, it kind of got better, and it was like, hey, I'm not going to kill you anymore. But on the 6th of October, I saw my PCP, and he changed me from Protonics to Nexium, and then he also added meloxicam in for my muscle and my joint pain, because yeah, I have muscle and joint pain. I have for years now, and we don't really know what's causing it. We don't know really what helps it, and Aleve helped it for a while, and then it didn't, and the Tylenol's not helping, and Ibuprofen doesn't help. So it's kind of like at this point, the doctor's like, okay, we're going to put you on meloxicam and we're going to see what that does. And the fact that it's getting colder anyway isn't helping. But we're kind of out of options on the meloxicam. But I started my Nexium. It was originally supposed to be 2 times a day. And the insurance gave me shit, gave the doctor shit. We're not going to cover it 2 times a day unless she's trialed this or unless she has this specific diagnosis. But we'll cover it once a day. So currently I'm on Nexium 1 time a day. And it is helping. Knock on wood, crossing fingers, doing whatever, putting it out there that it continues to help. That way I don't have to figure out, that way we don't have to figure out something else. But I also changed up my Mestinon from 6, I originally, when I started titrating off my Mestinon, I was at 60, 60, 30. So the doctor put me on 60, 60, 30, or no, 60, 30, 30 to titrate off. And I titrated back my Mestinon again to 30, 30, 30. So hopefully, and when I say 30, 30, 30, I mean 30 milligrams 3 times a day. But I'm titrating off that, and I'm doing good, and I'm doing good with the Mestinon, or the Nexium, and the meloxicam seems to be helping too. So where we're at right now is I'm just going to keep titrating off the Mestinon. I'm going to keep hoping the meloxicam and the Nexium help. And I'm going to go from there, and then with any luck, I don't have to see a doctor again until February. So, crossing fingers that that's actually how it works. Because right now I'm doing good, and everything seems to be helping. So, that's going to be it for this health update. If you like this video, give it a thumbs up. Hit the red subscribe button down below. Thank you for watching, and I will see you in my next video, which will be tomorrow. So, bye-bye.